Hello, this is Dr. Sutherland. Today I have a 30-something-year-old male and his niece coming in at the same time. They are in room 12 right now. It's down into the ER a little bit because all of the other rooms are occupied. So I believe the main patient's name is Gary Flynn, also known as JC. And I believe he is, the nurses have already hooked him up to IVs and have a bedpan. He has ketoacidosis, and he has brought his niece Blossom with him to be seen for, let's see, I've got to look at the charts here and find out what she has. I think, okay, it says the mumps. So Blossom has the mumps, and Gary has ketoacidosis. And this is diabetes type 1 related. It's never type 2. It is, as you see, ladies and gentlemen, diabetes mellitus is the most severe kind of diabetes that you can have. It is also called type 1. And when things get out of control, one can develop ketoacidosis. So what we're going to do is I'm going to walk down and greet them and introduce myself. I'm just walking down here, walking down the hall. Yep, looks like all 11 rooms are occupied. All right, room 12, here we go. Let's have a look-see in here. Hello.
Hi, Doc.
Hey, Doc. Hey, yeah, I understand you're Miss Blossom and you're here for mumps, is that right?
Well, I don't know. I just have lumps on my neck and I'm tired all the time.
Okay, nurse, let's get her a blood test. Okay, and I'm going to feel those lumps in your neck real quick here. I'm just going to kind of feel your neck and see if you got any swollen glands in there. Yeah, a little bit. I do see that. And you're tired all the time. You got any other symptoms?
Yeah, nausea.
Okay. Yeah, nurse, go ahead and get her this blood test. Now, Mr. JC or Gary, what do I call you?
JC's fine, Doc.
All right, I'll call you JC. You're here, it says on your chart you had a bout of severe symptoms, and including extreme long time with vomiting and some dizziness, some cold sweats and weakness and stuff like that.
Yeah, Doc, it's been going on for quite a little while now, several hours, I guess.
Alrighty. Well, what we're going to do is I'm going to cure you. And I'm going to tell you how I'm going to do that. I'll tell you what. I'm going to put Blossom next door into room 13 and keep you here in 12. Okay, so Miss Nurse, just take Blossom with you to room 13.
Yes, Dr. Sutherland. Come on, sweetheart. Let's go over here. Okay.
Alrighty. Now, Mr. JC, now I'm going to give you a blood test as well, and I need you to take this bucket here, this little thing with the handle on it, and piss in it. So I'll let you do that real quick here. Alrighty. Well, I'm going to go see if the blood test is complete for little Miss Blossom here in just a minute. And, alright, you got that filled up to the line?
Yeah, Doc, here.
Alright, I got it here. Now I'm going to give you a blood test here. I got my my kit here, and let's go ahead and give you a blood test. So here we go. Here I'm gonna just take 3 tubes here, if you don't mind, and see what's going on here. I'm going to take this stuff. Nurse, come over here out of the lab and gather Mr. JC's urine and blood to have it analyzed. Yeah? All right, very good. Now, all right, JC, well, nurse is going to be in the lab analyzing your blood and urine right now, okay? And she's also analyzing your niece's blood to find out what in the fuck is going on. All right? Very good. Okay. Now, in the meantime, let's see if we can, you know, the problem, JC, is not your blood, it's your pancreas. So, what I'm going to have to do is operate on you. I'm going to have to give you pancreatic surgery. All right. Let me get my knife here. I'm just going to cut into your stomach right now. Start getting down there. I've got to cut across this. Let me move your aorta out the way here. Oh, sorry about that. I forgot to give you painkiller. Our anesthesiologist is not in today. So, here, let me just put you out. All right, here we go. Yep. Business, money. All right. Now let me finish cutting there. Got to get back to the pancreas. Here we go. I think I've spotted it. Okay. I'm gonna take it out and have the tech boy run it to the auto zone and see if they can match it. Let's see here. Got it out there. We'll just put it on the table. And wait a minute. Wait, that's not an auto part. That's a pancreas. Here, I'm just gonna. Obviously, it's bad, and it won't control itself, so it needs to be punished. Here, I'm just going to throw it in the corner there, let the janitors clean it up, and we'll cross some tubes and wires here, and let me tie some tubes and wires together back in here, and and it'll sort of recycle through the liver, and some other issues in here. I can see his appendix is gone. Oh my, I also see that his gallbladder is, I can't seem to find it. I believe that, oh, there it is. Okay, that sucker right there. I'm going to tie some wires to it and then cross over behind the liver, cross these two together, and then a small external excrementary tube, which is secondary, I will tie into from the thyroid and hook this all with this one piece here to the vagus nerve, and that way the brain can still appropriate the correct levels of insulin in his blood. Alrighty, we've got these tied up here, and all right, let me go in the lab here and check on his blood. All right. I'll walk over to the lab here. Whoppa, business, money, stuffy nose. All righty. Let me look under the microscope at Blossom's ordeal here and see what's going on. Oh my goodness. She's got some virus activity going on there. Let me identify this. What in the hell is that virus? Let me look at that. That is mononucleosis. She does not have the mumps. She's got mono. Alrighty. Well, we know what her problem is. So let me go in there and explain to her real quick. Here we go. Hello, Miss Blossom. I found out what your problem is.
What's wrong with me, Doc?
You have mononucleosis. It's just a virus, and it's not all too common. It's not a yearly thing. You get it once in a lifetime. But what I want you to do is to go home, and you are excused from school for 2 weeks. And if your math teacher doesn't like that, feel free to let me know, and I will operate on him or her. Okay. drink a lot of fluid. I'm going to give you a prescribation for controlling nausea. That way you can get plenty of rest and not worry about having to pray to the porcelain. Alrighty?
Thank you, Doc. How's my uncle doing?
Oh, I'm working on him right now as we speak, so we'll get back with you in a little bit for discharge.
Okay.
Alrighty, now let me look at JC's blood work here. First of all, let me check his urine. Let me look in here and see what's going on. Well, look at the... wow. Well, there's some ketones floating around. Looks like everything's sort of out of control. These damn pharmaceuticals can never get their shit right. Alrighty. I'm gonna give him this piece of paper here. It's got some prescription, it's got some all-natural remedies that regulate blood sugar. And he can take this stuff and just take it, and he can still inject himself with insulin, but as he needs less and less insulin injection, he'll find out that these natural remedies will cure the condition. Whoa. Alrighty. Let me go back over here and check the blood. Now, what's going on in his blood? Let me take a look under the microscope here and find out what's going on real quick. Well, look at that. I'll be damned. It's not ketoacidosis. I thought it was, but it's not. It looks like a virus. He's got a terrible stomach flu. It's the it's the noro strain. Little bit early for this time of year. Usually comes around in October. Well, I guess I'll just have to prescribe him Imitrol for the nausea and Imodium AD for the diarrhea. And there's really nothing else we can do. As you said, let it run its course. So if he doesn't have that, why the hell did I take out his pancreas? Fuck it. He doesn't need one anyway. Alright, let me go back and explain to Mr. Flynn. Hello, JC, I mean. Oh yeah, you're sleeping. Oh shit. I forgot to sew him up. Let me get my 3-0 silk on Keith needle here. Sew him up real quick. Well, put some staples in them. Well, here we go. You know what? This shin on his left leg looks rather out of place. Let me get my rubber mallet and whack that sucker. There we go. Now it looks more straighter. It's bent down a little bit, actually. Anyway. Alright, that should help his walking. Not that he had a problem with it. I'm a damn good doctor. I'm 5-star. I can usually tell with my extrasensory bullshitception. Alright. Now, got some staples in there. Good. Okay, he's all sewed up and tied up. Alrighty. Let me wake up Mr. Flynn here and explain to him what's going on. JC, wake the hell up. Damn it, JC, wake the hell up. Yeah, Doc. Ow, why does my leg hurt so bad? Oh, my stomach is killing me. Oh, what the fuck did you do to me? Oh, I took out your pancreas, which is the primary organ responsible for causing all this shit. Well, it's responsible for all this bullshit that can happen. So, but you do not have ketoacidosis. You've got a norostrain stomach flu there, bub. So I gave her a prescription here. Here, swallow these Vicodins. I just gave you a shot in the IV of some Vicodin, so you should be feeling it. Actually, it wasn't Vicodin, it was Morphidone. So your pain should be going away pretty quick here. Yeah, I'm starting to feel high as a kite right now. Alright, so, I'm writing you a prescribation for, how's my niece, Doc? Oh, well, she's fine. She does not have the mumps. She's got mono, and it's rare for a person her age, but she's never had it, and she got it. So I told her just take it easy for 2 weeks, drink a lot of fluid, and she can help take care of you while you're healing up.
All right, Doc. Okay, what about me now?
Well, phew, that's one smelly fart there, Bubba. Anyway, as far as you're concerned, I gave you a prescription for Vicodin. Now it's going to take about 2 months for your belly wound to heal up completely. So you take it easy. No excess coughing and shit like that. No work. You cannot work. And I'm giving you a note. So you have prescription for this one is called Bactrim. It's a high-powered, it's a kick-ass sulfur-based antibiotic to prevent infection. You understand? And your pain medication is Vicodin at 357s, 1,000 milligrams. Take one of those every 4 hours. And this is a secondary backup pain medication called Morphidone at 10 milligrams. So if the Vicodin doesn't work, stop taking them and take the Morphidone instead. But do not take them together. Do you understand?
Yeah, Doc.
Oh, yeah, okay. I'm gonna get in a wheelchair here and go. Yes, you two are free to go, and don't forget this here piece of paper. It's got all kinds of cassava for the natural remedies to help control your blood sugar. Everything else is normal. You're going to be fine. You're doing fine. So have a nice day. And oh, by the way, I straightened out your shin there.
Yeah, I can feel that, Doc.
Oh, thank you. Oh, God. All right, bye-bye now. Bye, Miss Blossom. I'll see you guys later. I hope, because there's more money for me. Business, money. Stuffy nose, business. Alrighty. That was a 2-patient run. I've treated 2 patients at one time. So, this has been Dr. Sutherland. I'm a damn good doctor. Nurse, be sure and get the janitors in here to get that pancreas thrown away.
Yes, Dr. Sutherland.
Okay, good. So be sure and join me next time for my next medical emergency. All right, bye.